Vanakkam, I am Dr. Nityanisha, working as an assistant professor, faculty of physiotherapy in an esteemed organization, Dr.M.G.R. Educational and Research Institute, past 9 years in the department of orthopedics. Today, we are going to demonstrate the myofascial release technique. What is myofascial release technique? That is, myo means a muscle and a fascia that connecting the muscle. So, it covers the muscle in a protective way. So, myofascial release that used for reducing the pain and also reducing the tightened muscle to give relief of a pain. The myofascial release are of two types, that is a basic types and the advanced type. The basic type, trigger point release, trigger point pressure release and self myofascial release. In an advanced type, we have two techniques, ischemic trigger point release and also instrumental assisted soft tissue mobilization tool. Though we having a universal IASTM tool, that is instrumental assisted soft tissue mobilization tool to reduces the muscle tension. So what are all the indication? என்ன மாதிரி கண்டிஷனில் வந்து நம்ம myofascial release பண்ணுவோம் அப்படின்னா fasciitis, that is myofascial tightness, that is muscle tightness, fibromyalgia and the muscle spasm, then a soft tissue tightness and also the inflammation of the fascia. So then what are all the contraindications? என்னென்ன கண்டிஷனில் myofascial release கொடுக்க மாட்டோம் அப்படின்னா, நம்ம வந்து ஒரு டெம்பரேச்சர் இன்க்ரீஸ்டாக இருக்குது, ஒரு ஃபீவர் இருக்குது பேஷண்ட்க்கு, ஹைப்பர் பைரெக்ஸியா கண்டிஷனில் myofascial பண்ணக்கூடாது. நெக்ஸ்ட்டு இஃப் த பேஷண்ட் ஹேவிங் அ ஓப்பன் wound, it is contraindicated, and also a psoriatic skin, that is a skin infectious condition, is contraindicated for myofascial release. Now we are going to demonstrate a patient affected by a plantar fasciitis, that is plantar fascia of the patient is inflamed here. We are going to give a myofascial release technique in the universal. This is universal instrumental assisted. This tool is a universal instrumental assisted soft tissue mobilization tool where we are going to apply a myofascial release technique in an advanced technique to reduce the muscle tightness. Okay, the technique starts with the to and fro movements of the taut bands, and also the stretch will be given in the myofascial area, stretch the muscle to reduce the pain. Okay, we are going to apply a lubricant. This is a lubricant, that is ultrasound gel over the muscle bulk. The holding position of the tool, index finger in the rounded part and hold the thumb over it. Spread the gel, first fall, spread the gel. Then the technique starts with hold the instrumental assisted soft tissue mobilization tool, and first of all you should scan the tissue. Scanning the tissue. Then we are going to step 2, that is scooping of the tissue. Then move on to separation of the plantar fascia and also the TA tendon. Separation of the plantar fascia, the TA tendon. This technique is repeated. Scanning of the tissue, scooping of the tissue, and also separation of the plantar fascia from TA tendon. This technique is repeated 15 strokes. Given for the tendinopathy, tendinitis and also all the inflammatory conditions and also the pain syndrome. As a result, after completing the technique, we should apply the cryotherapy and also stretching for the calf muscle, strengthening the calf muscle, along with the follow-up exercises regularly. So after completing this, the patient should attend 3 sessions per week. After applying this technique, what are all the mechanism, that is physiological response that takes place in the tissue, or after completing the myofascial release technique, what are all the changes, that is physiological changes that takes place in the tissue, are that stimulating the mechanoreceptor to reduces the pain threshold, and also the pain gate mechanism, that is a pressure point where we applying by the myofascial release, that gives a pain gate mechanism by the counter irritation pressure. So these are all the effects of myofascial release technique. After completing the technique, what are all the physiological responses that takes place in the tissue, are that stimulating the mechanoreceptor to reduces the pain threshold, where we applying a pressure threshold that gives a pain gate mechanism as a counter irritation pressure. So that that is instrumental assisted soft tissue mobilization tool is best. Apart from using the modality, it gives earlier and soon responses in reducing the pain. Thank you.